So other materials which are added for purposes of improving functionality of the product, as well as improving on the delivery of the active ingredient, are what we refer to as excipients. So when you are looking at excipients, we note that there's quite a large number of them, and you cannot just pick these excipients anyhow. So there are guidelines which have been put in place for you to follow when you are selecting excipients. So there are a number of recommendations. One of them is that you must choose these excipients with caution. Of course, they are naturally considered as innate materials, but the selection, which excipient you choose, is going to determine the efficiency of the product that you are manufacturing. So specifications for excipients should meet guidelines that have been put in place as a way to aid the selection process. So we have standard guidelines which you need to follow. And when you are looking at a wide variety of excipients, you must follow those guidelines. One of them is that the excipients must not be harmful, should be physiologically innate, non-toxic, and must be listed as GRAS. So GRAS referring to generally regarded as safe material. So when you choose the excipients, ensure that these excipients are not going to be harmful. Physiologically innate, we know that the API, pharmaceutical ingredient itself, alters the physiological environment. And so what you are interested in, you want just the drug to be the only thing in the product that is altering the physiological aspect of the body. It shouldn't be toxic, otherwise you are going to cause more harm than good. Secondly, it should exhibit stability with no drug excipient compatibility. So if you choose an excipient that is not exhibiting stability, the entire product that you are going to make will have compromised stability. Also, no drug excipient incompatibility evident. So what you are looking at is, you do not want an excipient that is reacting with the active pharmaceutical ingredient. So this excipient should be free of any interactions with the drug excipient. Of course, there are certain exceptions, and you see that there should be a genuine reason for you to choose an excipient that is interacting with the drug. That interaction should ideally be defined as a beneficial interaction. So interactions can either be physical or chemical in nature, and see, mostly we see that we'll look at this again as we move on. The physical interaction or chemical in nature, mostly you can't avoid the physical interaction. But if the physical interaction is not resulting in any detrimental effects, then that is fine. There are even certain physical interactions which in which you can have beneficial interactions, but most often chemical interactions are detrimental. The interactions also with other excipients in the formulation or other packaging or packaging materials should be absent. You are not just using one excipient, you use more than one excipient very often. And so that excipient should not interact with another excipient. And also they should not interact with the packaging materials because the stability of the product will then be compromised. Another condition is that the excipients should not interfere in the validation process for manufacture or analytical testing. Okay, so whichever excipient you use should not result in interference in validation processes of manufacturing or analytical testing. So when we talk about validation processes, I talked about this earlier, this refers to demonstration that the process that you are undertaking is capable of yielding the same results over and over, regardless of who performs the experiment, where the experiment is being performed, what time it is being performed. If you maintain the conditions, you must get the same results. So excipients should not interfere with this process. Then there are other factors that we consider as well. The excipients must have ease of accessibility. There's no point in choosing an excipient which is not easily found. So if you are having difficulties accessing the excipient, then you are going to be producing expensive products. So they must be widely distributed and also affordable. So you must consider the cost. Everything in the pharmaceutical industry is about money. You must consider how much money are you spending compared to what you are going to get out. Then satisfactory compliance with regulatory requirements that may include environmental issues. So in certain countries, some excipients might not be allowed, maybe because of their impact on the environment. And the issue of the environment is something that has gained a lot of mileage. Everything that you do, you must justify that you are not harming the environment. So the excipients must be able to comply with regulatory requirements in all those countries where the product is intended to be marketed. There are other factors that you can consider in selection of pharmaceutical excipients. Those are classic factors which we just talked about, basic guidelines that have been put in place. But there are other numerous factors which you have to consider. For example, the type of excipient selected is highly dependent on the API to be delivered. Okay, so you must have a look at the active pharmaceutical ingredient itself and see what are the suitable excipients. Ideally, what you are looking for is an excipient which will easily allow the active pharmaceutical ingredients to be delivered to a particular environment. Also, the intended form of delivery. That's why we get to see that there are different categories of excipients. Are you intending to deliver the drug as an oral solid drug delivery system? Or are you going to deliver it as an oral solution, or is it a parenteral drug, or are you going to use a transdermal? Is it a topical preparation, and so on? So the intended form of drug delivery is going to dictate which excipients you can use. So we see that appropriate formulation composition and parameters are critical to be evaluated. You must know exactly what the composition is going to be for you to choose appropriate excipients. So you have different excipients. So we have excipients for solid dosage forms. We have excipients for liquid dosage forms as well. So what I've done in these I'm busy trying to admit more people. Some people are trying to join. So what I've done is that I've listed a number of excipients. So you have excipients in solid dose formulations. I won't be able to complete the whole lot of this, but we can go through a few of these slides. Most of them are self-explanatory and you can read on your own. So we see that the basic principle is that in addition to active ingredients, solid dosage forms will also contain a large number of substances which we refer to as excipients. This is what I was talking about earlier. The role of excipients is to ensure, is essential in ensuring that manufacturing process is successful and the quality of the resultant formulation can be guaranteed. If you do not add excipients, we find that the manufacturing process itself becomes cumbersome. And we'll see this when we start talking about tableting. For example, you can have a drug powder. This drug powder might not be flowing properly. And if it is not flowing properly, you might need to add other materials. Like, for example, we did talk about, you can add lubricants, you can talk about glidants. If you determine that the angle of repose, which determines the flow characteristics, is quite poor, then you add those excipients. That also simplifies the manufacturing process. And there are many other examples we'll be looking at as we move forward. The appropriate selection of excipients and relative concentrations in the formulation is very critical. So first of all, what excipient you choose, and secondly, in what amount or concentration should that excipient exist in that formulation. This is very critical for you to have an appropriate product. Generally, we regard these excipients as innate, but studies have shown that actually these can cause can have an effect on stability, bioavailability, and processability. There's going to be an influence on the overall stability of the product, the bioavailability, how much of the drug eventually becomes available for pharmacological activity, and processability, how you handle all the manufacturing processes. So excipients are categorized into groups according to their main function. These are the classes that you find. So we have what are referred to as diluents. In diluents, these are innate substances which are added for processing, just to increase the bulk of the tablet or capsule for processing and handling. So we see that the lower limit for formulation of a tablet is usually around 50 milligrams. But we get to see that there are a lot of other active pharmaceutical ingredients which present in or which are given in doses lower than 50 milligrams. So you've got 5 milligrams, 10 milligrams, and so on. So if you were to attempt to manufacture tablets of only active ingredient which are less than 50 milligrams, the manufacturing machines, the tableting machines available will not be able to accommodate that figure. Usually we are looking at the minimum of 50 degrees Celsius. So in order to reach this level, you need to then add other substances just to increase the bulk. And these are referred to as diluents. Okay. Ideally, these should be chemically innate, non-hygroscopic, and hydrophilic in nature. Also, we need to ensure that they have acceptable taste, which is important for oral formulations. And cost is always a significant factor in. So when you the categories of excipients that you find available in the pharmaceutical industry. So we were looking at diluents, and we discussed the typical characteristics of diluents, what you are looking for in a diluent or in a substance for it to be suitable for a diluent. Then we were looking at some examples of diluents. We have lactose, and we've given, we've shown that this lactose has got most of the characteristics that we are looking for in a diluent, and is quite suitable for widespread use both in tablets and capsules, except in cases where you've got lactose intolerance. That means that if you are dealing with a patient with lactose intolerance, you must check the excipients that have been used in that tablet or capsule. If there's lactose, then that patient should not be given that drug delivery system. So we also noticed that lactose exists in different grades depending on the particle size distribution and flow characteristics. So you can choose depending on what qualities you are looking for. You also have diluents for direct compression. You can specifically choose certain diluents which are meant to be used when you are using direct compression. We'll talk more about direct compression. This simply involves a situation where you take the active pharmaceutical ingredients and the excipients, you blend them without modifying anything, and you take them to the compression machine or the tableting machine. We'll look at the types of tablet manufacture available later. Then you have another excipient which is commonly used, which is microcrystalline cellulose. This microcrystalline cellulose, one of the most widely used brand referred to as Adicel, which is purified, partially depolymerized cellulose, prepared by treating alpha cellulose with mineral acids. So this is another commonly used diluent, and we see that it is used as a filler, as a diluent, but also has got special characteristics to be used as a dry binder and also used as a disintegrant, depending on the concentration in which it is used. So those who've got questions, please keep your questions. I need to breeze through first and get to the end of it. So write your question down, we'll get back to you when I pause. Okay, this microcrystalline cellulose is what you refer to as a multifunctional excipient. It can act as a filler or as a diluent. By the way, diluents are also referred to as fillers. It can also act as a dry binder, also act as a disintegrant. We'll look at the definitions of these binder and disintegrants shortly. Okay. Also, just like lactose exists in a variety of technical specifications. So depending on the particle size and crystallinity. So you have, for example, Adicel pH 101, 102, and so on. Those numbers representing the particle size distribution that are present in that product. Often used as an excipient in direct compression formulations, but can also be incorporated if you are engaging in wet granulation as a filler for capsules for the production of microspheres. So quite multifunctional microcrystalline cellulose. Okay, diluents are assumed to be innate, but we have seen that they do have an influence on the stability or bioavailability of dosage form. For example, you have dibasic calcium phosphate, both anhydrous and dihydrate forms, used as a filler binder for direct compression. We see that this is particularly useful in vitamin products as a source of both calcium and phosphorus. This excipient, dibasic calcium phosphate. But we see that milled material is typically used in wet granulation. Then the coarse grade can be used in direct compression. When we talk about the milled material, this has got a smaller particle size distribution. The coarse grade has got a higher particle size distribution. It is insoluble in water. Its surface is alkaline and is therefore incompatible with drugs sensitive to alkaline pH. So you have a look at this characteristic, and you know that even though we consider these diluents as being innate, the typical example tells you that you can have excipients causing incompatibility. So you must be careful when you are using dibasic calcium phosphate. It may also interfere with the absorption of tetracyclines. So it should not be included in formulations of tetracycline. Then you have other category of excipients referred to as binders. So binders are added to formulations to promote cohesiveness within powders, ensuring that the tablet remains intact after compression, as well as improving the flow of forming by forming granules. So when you are putting powders together, you want to ensure that when you compress these powders, they must be able to stick to one another. Lawrence was asking earlier about, is it a possibility of powders not being able to stick to one another? So the selection of the binder is important, and also the concentration of the binder that you are using also is important. That will dictate the strength of cohesion that exists between powders once you compress them. So a binder should impart adequate cohesion without retarding disintegration or dissolution. So we are looking for a fine balance, really. If you look at this, you are looking for a material that is capable of holding the powders together, such that during the normal processes of handling, a tablet should not easily disintegrate. But at the same time, you want, once this tablet is taken into the body, it reaches the stomach, it must be able to disintegrate in GI fluids so that dissolution can take place. That is the only way the active ingredient is going to be released. Okay. So binders can be added either as a solution or as dry powders. They're added as polymers are mixed with other powders prior to agglomeration. These are simply processes, but what we get is the function of these binders. So you can manipulate binders in a variety of ways. In short, what we are simply saying is you can add the binder as a powder, or you can first convert it into a solution and add to the larger powder blend, which can be either sprayed or it can be poured onto the blend and then mixed with the powder blend. These are some of the examples of binders available. You've got starch, gelatin, certain sugars used along with gums such as acacia, sodium alginate. These are polymers which you've already looked at, the gelatin, the starch, sodium alginate, acacia, naturally occurring polymers. These are used as binders at concentrations between 2 and 10% weight per weight. Okay, then you have celluloses, polyvinyl pyrrolidone, which are used as dry binders as well. Then you have another category of excipients, which we refer to as lubricants. So lubricants reduce the friction between the tablet and the diol. This is the machine, a small hole in the machine, a compression machine or tableting machine. If there is no friction, we find that the powders are going to be sticking to the tableting machine, and you are going to have problems during compression and ejection. So you add materials we refer to as lubricants, so that you have reduced friction between the powders and the diol. So there are different categories. The most commonly used are derivatives of stearic acid and stearic acid salts. For example, you have magnesium stearate, which is the most commonly used lubricant. These are usually used in concentrations less than 1% weight per weight in order to minimize any deleterious effects on disintegration. So magnesium stearate is hydrophobic in nature. So you must take care of the concentration that you are going to add. If you add a high concentration of magnesium stearate, you are going to turn the entire powder blend into a hydrophobic material. That means that the tablets or capsules you are going to manufacture from that blend is also going to be hydrophobic in nature. And if it is hydrophobic, it means it cannot attract water. And so the drug embedded into that tablet will not be able to dissolve because it is not coming into contact with water. It won't disintegrate, and there will be no dissolution taking place if there is no disintegration. So we use this in lower concentration. Okay, so ideally they are also added at the end of powder blending. So when you are mixing, or add these lubricants, and you also reduce the time of mixing. Usually mixing time is restricted to about 3 to 5 minutes, just to ensure that you don't turn the powder blend into a hydrophobic material. You have within the same category of lubricants, you can subdivide lubricants into what we refer to as glidants and adherents. These are the ones I've shown here. So glidants, these fine powders that may be required for tablet compression at high production speeds to improve flow properties of the material into the dye. So glidants typically reduce the friction between powder particles. And once you reduce, we know that the flow characteristics of powders is dependent on frictional forces acting between particles of the powder. So if you reduce the friction between particles of the powder, you are going to increase the flow characteristics. So in cases where you find that you have poor flow characteristics of the powder, you can then add glidants. Anti-adherents typically refer to those materials which you use to reduce friction between the powder blends and the wall of the tableting machine. Examples of these materials include colloidal silica, which is quite popular, and other starches and talc. So anti-adherents have, as I've said, added to the formulation to reduce sticking to the dye surface. Examples commonly used is magnesium stearate, but also talc and starch also act as an adherent as well, in addition to acting as a glidant. Then you have materials, other category of excipients referred to as disintegrants. So these are added to a formulation to overcome the coercive strength imparted during compression. When you compress the powder blend, you get to have this hard structure, but you want this hard structure to disintegrate once it reaches the GI fluids. So in order to assist the disintegration process, we add materials referred to as disintegrants. So these disintegrants are added to overcome the coercive strength that is imparted during compression. And these can either be intragranular or extragranular, or both, depending on how you add them. When we say intragranular, this means that you added the disintegrant to other excipients and blended them to form a homogeneous mixture. But if you talk about extragranular, these are added at the end once you have completed the manufacturing process. These are then compacted onto the surfaces of the tablet. So ideally, what happens is that on contact, disintegrants can draw water into the tablet, and then it's going to swell, forcing the tablet to break apart. Okay, so that's typically taken as how disintegrants bring about disintegration. First, they will draw water into the tablet, and then they will swell. Once they swell, they force the tablet beyond its normal dimensions. So I've added a number of examples. You've got starch as widely used as a disintegrant. It swells when wet. It has also been reported that the action could also be due to capillary action. That is, it draws water into the system, into the tablet. Once it draws water into the system, it then disintegrates, forming passages within the tablet. So because of the main capillary passages created, that results in the disintegration of the tablet. So you can use it in levels between 5% to 15 to 20% if you need. Disintegration is very related to the concentration of the disintegrant that you are going to use. Surfactants have also been used as disintegrants. Obviously, we know that surfactants promote wetting of the formulation. So that promotion of wetting results in disintegration of the tablet. Okay, so you have, I think we've added other mechanisms. Tablet disruption following production of carbon dioxide is another mechanism to enhance disintegration. So we see that sometimes you can use a mixture of sodium bicarbonate and a weak acid such as citric acid or tartaric acid. So I was talking about effervescent tablets, and I'm sure most of us have seen how these work. So the mechanism of disintegration there is the generation of carbon dioxide, where sodium bicarbonate reacts with a weak acid. And then once carbon dioxide is produced, it wants to get out of the system. In the process, forces the entire tablet to disintegrate. You have what we refer to as super disintegrants. So here, compared to the more traditional starch, newer disintegrants are effective at much lower levels and comprise of 3 groups. You've got modified starches, modified cellulose, and cross-linked povidone. So the difference with these is that compared to the traditional ones, that these, you can use them at much lower concentrations to bring about disintegration in a formula, in a tablet. So super disintegrants called so because of the relatively low levels of these disintegrants required. So if you look at starch, you need something between 5%, sometimes even 10 to 15%, as we saw earlier. But with these, you can use as low as 2 to 4% weight per weight. Okay, so I've listed some of these, the examples: sodium starch glycolate, what it is made up of, and it is able to act within 30 seconds. It can swell up to about 20-fold increase, and that becomes very efficient in causing a disintegration. Then you have cross-povidone. Again, I'm seeing that we're going to have to log on. I'm remaining with quite a few slides as well because of the interruptions, and we started late. Do you have a lecture at 10? Please confirm.
Yes, sir.
Do you have a lecture at 10?
Yes, sir.
Okay, so then we'll see how far we can go. If it logs us out, we can come back and take it up to 10 hours. Then we can continue next week. Okay. So cross-povidone also completely insoluble, but rapidly disperses and swells in water. That is why also it's used as a disintegrant. Exhibits high capillary activity and pronounced hydration. So these are tendencies of a good disintegrant. So also exist in different versions. You have micronized and milled and so on. Then cross-camelose sodium as well. That's another example, a cross-linked polymer. Also insoluble in water, but rapidly swells 4 to 8 times its original volume. So when you are looking at what I'm asking of you is that when you are looking at these excipients, what is key is you know what they are used for, you know their characteristics. So that will help you to know where exactly they are used and why they are used for that purpose. Then we have what are referred to as the added functionality excipients. In our discussion, we've might have painted a picture that each of those excipients perform a singular function. But technology has resulted in production of excipients which have got more than one function. So you find that in order to reduce the number of excipients that are added to a formulation, technology technology has allowed us to have a single excipient that is able to perform more than one function. Okay, so I gave an example earlier of microcrystalline cellulose. So these excipients, added functionality excipients, are able to perform more than one function. It's performing a function as a diluent, it's performing a function as a binder. It is also able to perform a function as a disintegrant. So these are what we refer to as added functionality excipients. Then you have colorants. Colorants, obviously, for the sake of identifying the product, if you want to a product to have a unique color as its identity, you can add what we refer to as colorants. But we see that there's been a safety concern of coloring agents worldwide. And so in a number of countries, there's a restriction on the use of colorants. In any case, people always tend to argue, why do you want to color? What is it that you are trying to hide? That's why you've got the majority of the tablets being existing in white color and so on, because it's easy for you to see the quality of the product from a visual perspective, that is. So if you are going to be adding colorants, you must check with the regulations in your country whether such colorants are allowed to be used in the country, in the tablets. We've given examples of colorants, sources of colors as well. You can have a look at these pigments that are used as coloring materials. All these are talking about pigments and dyes used as coloring agents. Then I've also included excipients for liquid dosage forms. The key things that we note of here is that there is need for you to add preservatives. We know that water is a medium for microbial growth, so preservation of the liquid dosage form becomes important. And I've added examples of preservatives that are commonly used. Okay, so examples include benzoic acid, and I've added also the concentration sodium benzoate and the combinations of methylparabens, propylparabens, and so on. So these are commonly used preservatives. Then you have flavorants when it comes to liquid dosage forms as well. You want to have a certain flavor. This is important, particularly for acceptability purposes, especially in pediatric formulations. The colorants as well, just as in solid dosage forms, you also have colorants. But we see that mostly the coloring material that you are going to choose usually goes hand in hand with the flavor that you intend to pick. So we see green goes with mint, brown will go with chocolate, etc. Okay. Then you have sweeteners as well. Again, important for pediatric formulations. Sucrose is one of the most widely used sweetener. There are other sweeteners which you can use, particularly in cases where you are formulating products that are going to be used in patients who are diabetic, because we know that sucrose can exacerbate diabetes. So you can choose other substances such as sorbitol, glycerin, or propylene glycol. These have got syrup-like properties and are good for diabetic patients. Okay. All those are just talking about, and then you've got suspending agents in cases where you are manufacturing suspensions. You can use suspending agents. And this should ring a bell from last year's lectures under colloidal systems of suspensions and emulsions. So you can add suspending agents which prevent sedimentation of the suspended particles. I've also added a number of examples: tragaganth, compound tragaganth, and so on, and bentonite for external suspensions, these interactions. So they are all frequently observed and used in manufacturing processes, but more often unintended and may cause a number of problems. Okay. Different physical interactions have been recognized and include formation of solid dispersions, complexation, and adsorption. So we are looking at solid dispersion and the techniques and complexation area under improvement in solubility characteristics. That in itself is regarded as a physical interaction, but it is used on an advantage side. There are also complexation aspects which can be advantageous and some disadvantageous. All these are interactions between the API and the excipient. So examples of physical interactions have been observed, for example, between primary amines and the microcrystalline cellulose. In the API binding, the MCC, so if a drug has got a primary amine and then you combine with the MCC's microcrystalline cellulose, we see that this interaction usually result in the drug not being released during dissolution testing. And this means that that product is going to fail the dissolution test. You've got other examples, for example, physical interaction which occurs during mixing, in which smaller particles interact with surfaces of larger carrier molecules. So you've got a larger particle and then smaller particles get deposited onto the larger particles. The result is a homogeneous powder blend. So this, in a way, if you look at it, if you're looking for a homogeneous blend, this is going to be a beneficial interaction. Then you have chemical interactions. Very often we see that chemical interactions are detrimental. Okay, almost always these are detrimental to the stability and performance of a product. So they generally result in production of degradation products. So we see here that there's a chemical interaction between the excipient and the active pharmaceutical ingredient. I've also gone on to give an example of a typical chemical interaction. You can have a look at this on your own. So you can, as I've been indicating in these two types of interactions, the chemical and the physical, you can have what are referred to as beneficial API excipient interactions. These are going to improve on the functionality of the product once you combine the API and the excipient and you've got a beneficial interaction. An example that we have given is simple manufacture of solid dosage forms in the presence of magnesium stearate, which interacts with other excipients, resulting in lubrication of powder blends. we've listed this magnesium stearate as a hydrophobic lubricant, one of the most commonly used. Its addition to the powder blend results in lubrication. That is a physical interaction, and will result in improvement in the flow characteristics of the powder blend. So that in itself is regarded as a beneficial physical interaction. Okay. Another example includes complexing agents such as cyclodextrins. I think we did look at cyclodextrin complexation. These are reversibly bound to the API to form complexes that improve the bioavailability of poorly soluble compounds. That also is a beneficial physical interaction, and we spent quite some time looking at that. Then you have detrimental API interactions. These are interactions which result in performance failure of dosage forms. So the dosage form doesn't perform optimally because of these interactions. Again, here we use the example of magnesium stearate, which is known to cause reduced tablet hardness and impact the solution rate of the API. Earlier, I was mentioning that if you use magnesium stearate, a hydrophobic lubricant in high concentrations, you are going to turn the formulation into hydrophobic material. So you are going to reduce dissolution rate. Also, if you blend for a prolonged period of time, you can also have a negative impact on the dissolution. Okay. Then there are other detrimental API excipient interactions, the issues involving colloidal silica, complexation with polyethylene glycol 400. You can have a look at these on your own. So now, there are different methods that we use to study compatibility between API and excipient. Okay. So advanced analytical instrumentation is now available, so you can rapidly identify potential excipient-induced instability. Any material that is going to exhibit incompatibility can be rejected very early in development of the product. So some of the commonly used methods are here. We've listed them. You've got differential scanning calorimetry, thermogravimetric analysis, X-ray diffractiometry, Fourier transform infrared spectroscopy, nuclear magnetic resonance, scanning electron microscopy. Some of these could be familiar to you, but I'm not going to get into a lot of detail on how these actually work, considering that I'm not in a position to demonstrate how these work. It would be way better in a physical form of a lecture. But there's a table at the end there, just to demonstrate how or what kind of information you are going to be getting from this. So if you look at here in this column, I've got the investigative technique, and then in the middle, I've got measurement, and then utility of information. So what it is saying here is that DSC is referring to differential scanning calorimetry. You can refer to the previous slide here for the abbreviations. And then for the measurement, we are taking what is it that you measure. So for example, in the case of differential scanning calorimetry, energy is absorbed or released by a sample as it is heated, cooled, or held at constant temperature. So utility of this information, you use this information to determine physical compatibility of API and excipient or polymorph characterization. So in typical sense, each substance is going to have a specific what we call thermogram of how, which is going to be telling you how much energy is going to be absorbed or released as you apply heat. And if you add the excipient, that amount of energy released or absorbed should still remain constant even after addition of the excipient. If there is any change in the amount of energy released or in the peak or shape of the peak, then you are going to suspect that you are having incompatibility. I want to see if I can quickly demonstrate what I'm talking about using this example here. So this is an example of a DSC, differential scanning calorimetry. So this is one of the experiments that I conducted when I was doing my MSc. This is nevirapine alone. So the typical characteristic of a thermogram is that it is going to give you a peak, okay? This peak that is here. The whole lot of this is referred to as a thermogram. So this peak, if you have a look at it, it is a narrow peak. At the far end, at the top there, that peak, this temperature is what is referred to as the melting point. So this is the melting point. And then it is going to give you the change in NH delta H. So this is nevirapine alone without any excipients. Then I combined this nevirapine with an excipient, okay, which is dibasic calcium phosphate. So we see that here, in the first instant, I had a peak occurring at 250 degrees Celsius. And then the peak itself was quite narrow. So what this information is telling me is that nevirapine has got a melting point of 250 degrees Celsius. And at the same time, because of the sharp, narrow peak, this is an indication that nevirapine exists as a crystalline material. When I combined this with dibasic calcium phosphate, DCP, I see that on the thermogram, I've got two peaks. Obviously, this one belonging to the new material DCP, and then the other one belonging to nevirapine. But if you see this, we see that the peak has significantly reduced in size. At the same time, it is no longer as narrow as it was initially. Okay, and if you check the peak, it is now occurring at 245.5 degrees Celsius from 250. From here, again, the principles are that if a peak is brought, then that material is existing as an amorphous substance. So from these two, you can conclude that nevirapine is moving from existing as a crystalline material to existing as an amorphous material. At the same time, its melting point is reducing from 250 degrees Celsius to 245.5 degrees Celsius once you combine it with dibasic calcium phosphate. So based on this understanding, I was able to reject and recommend that you cannot combine nevirapine together with dibasic calcium phosphate, which turned out to be actually true. When I forced matters and manufactured tablets containing nevirapine and DCP, I found that nevirapine could not be released from the tablets. After 24 hours of testing, I only had 18% of nevirapine released after dissolution testing. So this is an example of how you can use these techniques to predict whether you can use a particular excipient or you cannot. So in your case, I don't expect you to get into a detailed understanding of all these techniques like I have, but those who have significant interest to pursue the subject at higher degree levels of MSc and PhD, these are the things that you'll be looking at. So the only thing that I'm going to ask of you is that you should know what each investigative technique measures and the utilization of the information that you get. So for DSC, I've indicated you get energy which is absorbed, and you use this to characterize compatibility or polymorph characterization. TGA, you look at weight changes and what it measures. So you do this for all these techniques that I have listed here. The principles are the same. If you look at, for example, FTIR, which is Fourier transform infrared spectroscopy, each compound has got a functional group, and each functional group has got specific absorption frequencies. And so the expectation is that even if you combine an active ingredient with an excipient, you expect that when you conduct FTIR experiment, the spectrum you get will still be able to show the absorption frequencies of the drug. If they disappear or they shift, then you know that you are having incompatibilities. Same thing with the nuclear magnetic resonance, which looks at the arrangement of molecules in a compound. Each compound has got a specific NMR spectra, which shows how molecules should be arranged. So once you combine with the excipients, if the arrangement of the molecules are disturbed, then you know that there's going to be an incompatibility, and you should only choose excipients which do not shift the molecular arrangement or the absorption frequencies of functional groups and so on. So the principle is simply the same in all these techniques that we get to use. I've added a number of slides which further just explaining these techniques, and you can read for your own information what each of these techniques can do. And then at the far end, there's a table where I have added where there's a groups of excipients that are available. Okay, so you've got ingredients type, definitions, where they are used, and you've got examples. It's quite a very useful table, so you can have a look at this as well. I know that you are rushing, you've got the next lecture, and we've gone beyond time. But what you are going to do is that for those who have certain questions which we have not been able to respond to today, please write down the questions and we'll attend to those questions the first thing when we meet next week on Tuesday. Thank you very much for your attention. Unless you any questions? Okay, the lecture is over. We can pick it up on Tuesday at 6 hours. Thank you.